So we're back with some side lying techniques. We're going to work on Vicky, who I know is a bit hypermobile in the low back and a little bit in the hip joint, a little bit in the shoulder, just in general. So when you're working with somebody who's overly mobile, you want to really be careful about what you're doing with the joints. So I'm going to use my knees for this. So the hand is going to go first into the foot, the heel of the hand. And I just want to be careful that I have a straight arm and I'm not trying to force. So like if I were to ask Vicky, you know, how does this feel compared to that? What do you think, Vicky?
Yeah, the other was way
Yeah. So just be aware that it's really common to force your way through life in general, and then to force your way through giving your Thai massage. So just use your body weight. My whole body is rocking. I'm not making any muscles in the bicep. So then when I move, I'm going to use my knee. And as I use the knee, I'm going to move so I feel like I have a really good centered point of pressure. So my knee's not way out here. I'm not abducting the leg and trying to put pressure and moving my whole body with it. Again, be careful of calves. They do tend to be very tender and sensitive. And then after 3 runs there, I'm going to come and use it here. And this is actually a really good client, even though Vicky is not even close to being overweight. This is actually a really good technique for people that have a lot of leg flesh. The knees will hit a broader area, which is what you need when you're dealing with the extra bit of fat and muscle. So from here, how's this so far?
Good.
Okay. So what's usually done from here is to bend the leg and get a stretch in the hip flexors. Well, I know that she's a back-bending, friendly type of body, so I don't really want to go too far right off the bat. And see, she's helping me. So that's okay. You can tell when they're helping, because they move their leg, but you'll see that these muscles here start to, they tense up and you'll see them lift. So I know I don't want to take her to her max range. Why? Because she already has either enough flexibility or compensation in the low back. That's just because I know her. So if we take the knee past the sits bone, you want to be really careful. You better make sure that that client actually has the ability to do that safely. Otherwise, having the knee in line with the sits bone is probably for most people fine. And then from here, we're going to skip the lower leg region just so we can get to the top. So I'm going to switch. And I'm going to make sure I'm kneeling on the surface where the leg is. If you don't have enough surface, you might want to bring yourself up because you need to have leverage on your client to be able to get right on top. And I'm doing from the 2 distal points. So I'm going from where one of the hamstrings attaches down here by the knee and up on the side of the hip where the glute medius is. And I'm just pressing down and pulling apart. Pressing down and pulling apart. Then I'm going to take the famous knee. I love using the knee. It's great. It takes a lot of stress and strain off of your wrists. And then just press into the belly of the hamstring. My whole body's moving. I've got support on the hand that's not on the client. I'm just going to press in and out. It may not be very smooth on a lot of clients. You might get some resistance from ropey hamstrings. Just press on as best as you can. And if it's too much, then you can do what I call the cat technique, where you take the straight arms and the heel of the hand. You can do this anyway. And then a good way to finish this off is to come right on top, crisscrossing your hands and pressing on the side of the hip. Pressing, pressing, and pressing. Good. The end for that side. Thanks for watching.